I would love to introduce to you the Lambs. We have Justin Lam, who is the CEO and founder of Cool Blue VA Agency, specifically niched for health businesses, just like all of you are. And we have one of his esteemed clients, who happens to be his sister, no bias there, Dr. Carrie Lam, who is part of the most amazing and historical Lamb Clinic. I know you all know who the Lambs are. Don't act like you don't know. The Lambs are in the house. Hey, y'all.
Hi, Lauren. Great to be here.
Great to have you. Good morning. They are so nice, y'all. It's like 5 a.m. At Pacific time. Well, no, not really, but they didn't mind waking up early to drop their knowledge with us. Dr. Carrie, how you feeling today, my friend?
Yeah, we gotta, even though I woke up 4 times last night with the babies. It's like
Oh my, with the babies, how old are the babies?
Yeah, I have a 1-year-old and a 3-year-old.
Oh gosh, honey, I left those days in the dust. They are 9 and 11, and it is a whole new set of issues.
It
So,
goes from physical fatigue to like mental fatigue, right?
and then it crosses over, and it's this weird like purgatory where you're just existing, and but it's still so fun, and their babies are cute. So, do you have boys, girls? What do you have?
1 girl, 1 boy.
Oh, look at you, balanced. Okay. In my house, it is boys, so it's called the sausage party. It's sausage all day, all night in my house. It just is what it is. You have perfect balance. So, y'all, we're not talking about our families, even though we could all day. We're here to talk about how to grow your health business and how to thrive. And in functional and integrative medicine, it's getting more and more complex to how you share your story and how you make yourself seen and heard. And then when you get these patients into your funnel and you get them signed up with your programs, it becomes more and more complex on how you handle them and how you continue to keep everything balanced while you are still trying to grow your business. And one thing that the Lambs have done, specifically Justin Lam, is that he's created the coolest infrastructure, the coolest business to help the busy entrepreneurs, the busy medical practices manage your business. So you have this awesome agency. So tell us about Cool Blue VA Agency.
Yeah, thank you very much, Lauren. Yeah, so Cool Blue VA is a medical virtual assistant agency, and we get medical professionals that are based in the Philippines to work remotely during your office hours to help you out in your business, in your office, in your practice, with anything that you need short of touching a patient. So that can range from customer service to scribing, admin tasks, insurance, if you guys take insurance, really anything that's on a computer that you hate doing that's leading you to get burnt out. You can hand these tasks off to a virtual assistant for you.
So can we talk real for a second about this, the whole like offshore VAs and, there are some concerns I've seen. I'm a progressive individual, so I absolutely use VAs. We absolutely need to talk because I may need to utilize one of yours. But I find that a lot in the medical space, they're not leaning into the use of a VA like I think that they should. A lot of them are concerned with cost and the quality and all that. Like, for me, I've saved money and increased quality with my use of VAs. But like, how do you explain this to a doctor who's just not hearing it?
Yeah, that's great. A great question. Actually, we started using VAs. The reason we found out about VAs is because of Dr. Carrie's clinic. And she can kind of tell that story a little bit more about how everything came about. So why don't you let you talk about that, Dr. Carrie?
Jump in. Hey, Carrie, tell us.
So yeah, you heard that I have a 3-year-old and a 1-year-old. So our clinic actually opened like 4 years ago, right when the pandemic started.
Mhm.
And so, I mean, yes, it was already hard to find staff because it was really just, we opened by June of 2020, physically, okay, in the location. And so then that's how I started um, really trying to find alternatives to actually medical staff. And at that time, after you go through medical school, you go through residency, really you don't get any training at all on any admin, HR,
Nothing.
operations, and how to run a business. So yes, I was definitely a bad entrepreneur at that time, right? So And then we come out and I'm trying to not only do integrative medicine to be able to provide a lot of care for the patients, but then how do I actually write good notes, be able to bill insurance correctly, and answer all my phone calls and not get burned out. So by the time I came out, I was actually, burned out trying to do everything by myself. And so I was also trying to get pregnant and that was not happening, right?
Mm.
Um, so I decided to just like go and try to find a virtual assistant who would be able to help me, offload some of my load. And I would say, I started with one and then now it just went to two, and then now we have like 40 in our clinic.
You guys have 40? No, you don't.
It's addictive. Okay. So they're just amazing, right? Like, because really, okay, you can say, oh, I need someone to answer calls, but then now I have like 6 to 8 people answering calls. And then I have 2 per provider for scribing. So they take all our notes, right?
Hmm.
And so I can go home at 5 and go back to my kids,
Because it's always about the kids.
yeah, not to worry about them. And then, like I have trained VAs who would be able to send all my referrals, do the prior auths, check for insurance eligibility the day before also. So then I don't have to calculate, what's their copay, and how much am I supposed to be charging them? And then like I have, a whole back office team to do all the uploads and the insurance team, right? So
all you do is just show up, like wind machine in hair, slow motion into the office, like everything's just done for you.
And like they are just so helpful. And that's why, we all know that we've undergone like staph infections. I like that term. I learned it from another podcast.
Hilarious.
It's because, it's so hard to keep staff nowadays. And
That's why businesses fail, though. Like, it doesn't take away from who you are as a clinician. That's firm. You guys got that covered, programs and everything. But when you accept their money and then everything falls apart in the background, that's really why doctors do get burned out. I have more folks coming to me now than ever being burnt out with no systems with patient care
Mhm.
and then no systems with operations. So like, hopefully you never got to like a breaking point where it's like, oh my God, I need to hire people now. Because that's also how people make bad hiring decisions. You mentioned something very specific. Your people are quality. Like they're doing their scribing and billing. Like what all are they doing for you? Like we want to know. Give us the tea. What all are they doing?
Yeah. So I mean, in the beginning, we did, right? You want to know, hey, we went through the bad people, the people who really weren't trained, and so we kind of went through that so that the people at Kubu VA wouldn't have to do that anymore because there's a very rigorous screening.
Mhm.
We found out that yes, not one VA should not be multi-talented in doing all the stuff, right? Insurance, scribe.
Did y'all hear that? Did y'all hear what Dr. Carrie just said to everybody that's abusing their VA right now as a personal assistant and as a front desk and as a they're not multi-purposed. Okay, Dr. Carrie, I'm sorry, continue.
I mean, yes, if you find the right person with the right capability and over time train them. But in the beginning, they should really just focus on a few tasks that you give them, get them really good at it. And then you can add on over time. I do have a few select VAs that are my personal assistant, but that's just what they do. They're my personal assistant. They're not going to be like doing it, but they can cover a lot of the departments, but they're not necessarily going to every day because you also don't want to burn out your VAs, right? So,
But did you hear y'all? She has a few VAs. I love a bougie conversation. So we'll have to talk later, Dr. Carrie, about like how bougie you are with your personal assistants. But it's for a different. We're sticking with medical right now, right? Like, like it's just evolved over time. You're mentioning numbers, right? Doctors don't like paying for stuff. I don't mean to be offensive or rude, but these types of things usually are thought about like, well, how much is it? Well, this is what we tried to. We'll go buy the biggest laser or scanner or whatever, right? But when it comes down to the team, I know that tends to be a stopping point. So you have saved money, right? Probably and scaled since with the VAs. Like Justin, what's the cost structure of this like?
Yeah, so it's really, really affordable actually. To get a VA working for you, it's just $9.95 an hour, you know.
Awesome.
And so that's gonna be like half probably more than half of what you're paying a medical assistant, maybe like 60% off, as far as that goes, right? So, and you're getting qualified individuals. Medical assistants are great. I mean, but they're high school graduates. They didn't go to college, or they didn't go to, the VAs we get, they're like nurses in the Philippines, right? Or they've worked for 3 to 5 years. They have college degrees, so they have a lot of experience. And, like Dr. Carrie said, we had to go through the pains of learning what doesn't work with the VA so that we can make sure that it works for you guys. So now we have a rigorous 3-step interview process to make sure it works. Once we go through that interview process, then we go into having our training program to make sure that they can understand and process things correctly and learn skills to help doctors out. And then only 40% of our students actually pass our training program. So it's very strict.
I wonder if I would pass.
I'm sure you'd do amazing in the training program, Lauren. Yeah. And then because we also have an integrative practice, right? So we actually have an integrative training module that we can put our virtual assistants through as well. So they learn more about supplements.
Excellent.
Functional testing, all that. Because functional integrative medicine is, it's huge, right? And it's
And complex.
And complex, exactly. So, they're not going to be like experts at the end of the day, but every little bit helps to ease your training process.
Yeah, no, I love this. So, you convinced me, right? I'm gonna save some money. I'm gonna hire a team, but let's talk about the real stuff. I said I want to talk real. A lot of folks find that maybe there's some cultural differences that may not work or blend well with their environment, or maybe they're concerned that, someone answering the phone with an accent. Like, we can talk, right? This is just an open platform. Me, myself, and I have no problems with communication or any of that, but that is a concern. The cultural, the sound, the time difference, all the things. Like, how do you coach somebody up to be more accepting or understanding of this?
Yeah, so all of that is part of our interview process and our training program, right? So we interview them, we do oral interviews with everybody. We have testing that they have to go through, so we know that their English is good, they sound great. They're not going to be like 100%, but they're 90% there, right? As far as their English is concerned. And then we also, in our training program, we teach like cultural differences between the Philippines and America. So we teach them like, hey, Americans tend to be a little bit more direct, tend to be a little bit more straightforward and stuff. So,
This is so
you want to
true.
respond in kind with that, and so they understand the cultural differences a little bit more. As far as that goes. And really for the clients, I can understand some hesitancy, because it is a different concept, it's a different way of working. But that's why we're offering a 2-week free trial. So you can work with our virtual assistants for 2 weeks, 40 hours a week, total of 80 hours, absolutely free. That's $800 in value. And
2
see if
weeks.
exactly.
Let me get a to-do list real quick of some stuff I need done.
Yeah.
That's a huge investment. That means you have a lot of confidence in what you provide, right? Because I
Exactly.
can imagine onboarding a client isn't, there's some things involved. So that means that your process is good.
Yeah. The product speaks for itself, really. So once you get a VA in, once you get them working with you, you understand how much they're going to take off your plate. You can see it in action. You can see the potential of it, and really after that, it just kind of sells itself.
Yeah. No, I absolutely love this. And I'm curious to see how somebody could mess this up, because I feel like a lot of times it is the business owner or the CEO or the boss that messes up the relationship. I understand there is some management because you're involved. I'll ask you to explain how you're involved later, but I've burned through VAs because of my incapabilities, my bad communication, my lack of SOPs. Like, I don't even know for a lot of doctors if they would even be prepared to work with you. Like, Carrie, you had everything laid out. So when the VAs came on, you're like, yep, this is the SOP for answering the phone. Yep, This is how you respond to emails. Like you seem like you have it together. So
No, I had to create it. It's not, yeah, it takes work, definitely. And I went through the same thing you did too. It's like, well, you're just gonna stay on Zoom all day with me, like,
co-work.
and they do, right? Like um, it's something you have to learn. It's definitely not, and what is nice about Kublu VA is that yes, they kind of consult you sometimes through, hey, what are your biggest pain points? What are the first places that you can actually start using your virtual assistant most efficiently? What are the things that you actually ultimately hate doing at the end of the day that you can pass off? And so it is about, yes, like starting small, simple tasks, whether it's appointment scheduling or just follow-ups, or just doing billing, and then building that trust into what they can actually do, and then reporting regularly, checking in with them. This is all really important. And the SOPs are super important too. But what I used to do is just I would record myself on Zoom while I train them so that if they have questions, they just go back to that recording, like I'm not going to ask you again how to do it. Just watch that recording.
Just watch a video.
Yeah. And then they can actually make the protocol. Once they get more comfortable, they go back to that video and they make protocol. So my VAs are now actually making protocol.
They're running the show.
Yeah.
Yeah.
So
I like it. We all strive for that. Like have boss me around, please. Tell me what to do. Justin, do you help people? Like, is everybody press folded and ready to go that in terms of their business, or do you really have to help them help you work with your team with structure? They may not have structure. Like, how do you work with somebody with no structure?
Yeah, I wish everybody came that easy, right?
Right?
But yeah, no, we absolutely help people. Like Dr. Carrie said, we have been through the mill. We know exactly what doctors are going through, what practices are going through. So, if you have anything that we're struggling with, we'll help you figure out a way on how you can install processes, how a virtual assistant could potentially help with that situation. And we also like check in on a regular basis with our virtual assistants, so if they're struggling with anything, they'll talk to us and say, hey, I'm having a problem doing this, and then we'll kind of brainstorm with them how they can solve that solution, or we'll bring it to the doctors and say, hey, the virtual assistant brought this problem up, maybe we can try this out, maybe this is going to help both you guys out and, make things a little bit more efficient. So we're always looking for ways to improve and explore and see how we can help people out.
And I imagine it just kind of makes me think about, a lot of the practitioners who are talking about bad business owners want to be better. That leadership, a lot of them are lacking leadership to really be able to effectively lead a team, whether they be virtual, whether they be in person, whatever. There still has to be some core things in place so that they can work with anybody. And I do know, even with me and my own agency, that's why some relationships have failed with us, because they didn't have assets and they didn't have any proof for testimonials, like whatever it was needed for me to help them market. So like I imagine like when VAs make mistakes or in that first like 30, 60 days, like that's like the dating period where you're trying to figure out, is this a good fit? Like what do the practitioners do in the beginning when it's like there's errors and I can't believe they didn't clock in, or whatever their issues are. I'm sure there's a lot. Like, how do you help them navigate that? Because if it was a person that they're working with in person, I'm sure they probably give them 6 months or a year, to keep, messing up on the phones. But VAs, I know, don't necessarily have that runway. So, like, how do you help them like manage the mistakes or just like the evolution of the relationship?
Yeah, absolutely, absolutely. The VAs themselves are very, very motivated, sometimes I would say too motivated to their detriment,
Yeah.
because they're eager to work. They have like a different work ethic, it's just supercharged. So they're eager to work, they're eager to please. And so they're going to try their best and see. But sometimes people do make mistakes, that's why we have each client has a customer representative that works with them as well. So if there's anything going on, we try and check in with the clients every week as well. doctors aren't always great at communicating, but we still, try and put our best foot forward and reach out to them, see how everything is going, see how we can improve. So, we're always trying, like I said, to keep open communication and help the doctors improve, and get their best out of them.
Have you had to yell at anybody lately, Dr. Carrie, in your VA team, or has everybody just been tip top perfect?
No, I mean, you definitely like things happen, right? Even okay, people get COVID over there, or maybe the house is on fire. Like the excuses
Oh, I'm
usually
sure
are amazing, but
the
still,
power is always out, always. Like,
yes, the power is always out. I mean, they just had typhoons and things, so I mean that happens. But like we have a system. It's like called Time Doctor, where we monitor their screens. We make sure they're actually working. They're
oh,
literally on
nice.
Zoom with one of my office staff, like the whole day with their screen on. They're sharing their screen, so you can actually also see. You can monitor them. They're on chat like the whole day too. But
Nice.
yeah, when they have errors, no, we definitely pull them aside. Same as any employee, you give them warnings, written warnings or verbal warnings, and say, "I don't want to see this happen again." Like it's really they're like any other employee. They're just very, very polite, and
Very.
yeah, very polite, very hardworking. And they will take the criticism and they will improve. So that's what's really good. And ultimately, yes, if it's not a good fit, another good thing about Kublu VA, if you talk to them, like they will switch it out for you if they are not really able to find a fix to this relationship, right? Most of the time, yes, we can try to let's try to fix it. Let's see how we can implement other protocols so this doesn't happen, right? Is this a personal thing, or is this
Mhm.
something systemic in our clinic that's making you like this, right? So we have to evaluate both ends.
I'm glad you said that. You look at yourself as well.
Yeah.
See, listening practitioners is not just always the team's fault, y'all.
Yeah.
I love this discussion. I want to ask trust about the trust thing. Let's get into that. Because, in order to have somebody, up in your space, they need to have access to your Instagram. They may have access to some electronic medical records, patient files, HIPAA stuff. Some people billing, credit cards, bank accounts. Like it can evolve, right? Like, how do you navigate the trust dynamic? Or is it like a seniority thing? Or does it take time? Like, how do you feel comfortable just coming out the gate? And we were talking about bad entrepreneurs. Many of my clients have had office managers that were embezzling from them for years, right? They have had so many like negative experiences with trust, with agencies, with credit card
Mm.
fraud. How do you navigate that?
Yeah. So from our end, we get all our virtual assistants trained and certified in HIPAA to make sure they're all HIPAA compliant.
Yep.
They understand, and that happens on an annual basis. And then we also have regular, continual training to make sure that they're keeping up with everything as well. And then we also make sure we have all our virtual assistants registered with the government to make sure that they're qualified to work as a virtual assistant. So they have to get cleared by the Philippines government before they even qualify to work as a virtual assistant. We
Wow.
aren't just picking up Joe Blows off the street, right?
Yeah.
So we're very particular about that. We understand it's very sensitive, especially in the medical space. So we try and do our utmost to do that. And trust is built and earned. Right. So it doesn't happen overnight. So like Dr. Carey said, you want to start maybe with smaller tasks, admin tasks, answering the phones, scheduling appointments, and then you can build up. Once you know that they are able to handle it, give them more responsibility, give them more tasks, a little bit at a time. Once you know they can handle a little bit more, give them a little bit more, right? And slowly you start to build up the trust in your virtual assistants.
Tell me about kind of like the perfect, like, I guess, client type that would be a really good fit to start. Because most of the time, like I'm saying, most folks that I know use a VA in a more like social media, email marketing, tasks that are not related to the clinical side at all. That I don't see a lot of folks doing that. So that's why I really want to kind of dig into if I were to if I'm a doctor and I'm curious about how to use a VA for medical stuff,
Yeah.
not this email marketing stuff. Where do you think I should start? because this is a brand new concept to me.
Well, I
Yeah,
think
we break it down into 4 areas primarily. And we found that our virtual assistants are better when they're specialized, right? And they focus on certain areas what they're strength in. So number one is really customer service, answering phones, scheduling appointments, following up with patients, texting patients, all that stuff, right? A second thing, like Dr. Carey mentioned, scribing. So scribing is really important. That saves the doctor a lot of time, and more of the medical stuff. So like prescription refills, ordering supplements on like full script, uploading labs, right? All of that stuff is busy work, doing the chart prep, right? All the medical stuff that takes time away from the doctor as well, right? Third is admin tasks or like social media. So like data entry, managing email inboxes, managing your fax inbox, like submitting medical records, managing your referrals, right? All of that stuff. And then the fourth part, not so much common in functional integrated medicine, but insurance, so calling for prior auths, insurance verification, eligibility, collections, appeals, denials, managing all of that stuff there. So those are really what we found is the great ways for doctors to alleviate their burden, alleviate their staff's burden in those 4 areas.
Like were you going to say something, Dr. Carey, before I jump in?
Yeah, I think the first thing that, like the lifeline of your clinic are the phone calls that come in, right? Like if you are cash-based, you want to answer those phone calls because they could be potential patients calling in. And so our answer rate is 95% now. Like everyone knows the the pain of having to call a doctor, but then no one is answering. Like I hate that. So that for me, at least I know that, hey, my phones are being answered and they're answered well. Even if you have them just answer and take a message, like it still feels better, right? If you're starting out and they don't know how to answer the question, like, yeah, let me take a message and then we'll still be getting back to you. It's always better to talk to a person rather than no one answering the phone, right?
Can I ask you a quick question about that? Because I would say that most of my clients have brick and mortar practices, and they've never considered not a physical person answering the phone. And so that's one part, right? Like
It's so easy. Yeah.
their mind doesn't shift to that. Like I'm just telling you, like it just doesn't compute.
Yeah.
And then there's also too for people that are running advertising, they would love to use a virtual assistant to answer those calls, but are concerned with can they sell, or can they convert a patient? So you got two sides here. Can you dive into if you have a brick and mortar, how do you integrate somebody to take that job away from someone at the front desk, or does the front desk go away? And then the second thing is, do you think that this is best used for marketing leads, which are notoriously messed up?
Yeah, we use both actually.
Really?
So yeah, so we have a brick and mortar, but our front desk is so busy checking in patients. So I can imagine other doctors' offices, their front office is busy, with physical patients. So the calls that come in, they should be answered by a virtual assistant, and that can be easily set up. And Kublu VA kind of goes through that with you guys. And then we also train our customer service team on marketing and sales. This
Good
probably has to
stuff.
be done, like individually, but like we separate our calls, right? Our marketing comes in a certain number. So our customer service team knows, oh, that's the number. I need to pick up that in more priority compared to the regular phone calls that we get. And so, like, yeah, both answer rates are above 90% for sure.
Excellent.
Yeah.
And yeah, Justin can say a little more.
Yeah. Conceptually, what you really want to think about is that the physical people in your clinic are designed to provide excellent customer service to people who are physically showing up. And they're designed, and they should be bringing in revenue. So they should be doing procedures in your clinic, right? Things that are touching the patient, that are bringing money in, that's offering additional service to the people who are coming in. Everything else is a waste of their time, is not bringing in revenue.
Well, wow.
It's not
Say what you
contributing,
feel.
to the customer service, really, right? So all of that can be offshored or offhanded to a virtual assistant to do, right? At a fraction of the price to do that. That's conceptually how you want to think about it. And that will really change how you operate your practice and your business. All right. The second thing to that is, I actually just lost my train of thought. What were you talking about?
Well, we were talking about, that was funny. We were just talking about like literally like how to get to a VA, like they can do sales, they can answer a phone, like
Oh yeah.
how a
So for the
doctor can kind of
sales,
fix their mind for that.
yeah. So for sales, I mean, customer service, definitely they're very good. Virtual assistants. The
Yeah.
Philippines is all about hospitality, and I'm sure every doctor out there knows like a virtual assistant or a Filipino nurse, and they'll sing praises about them all day, I'm sure.
Mm-hmm.
So hospitality is like in their blood, and like for marketing, they can do marketing as well and sales. And I mean, because it's so affordable, you can set up an incentive program if you'd like to,
To
if they
bonus
close
them and
as a bonus, and it
mm-hmm.
doesn't have to be a big bonus because it's not you're not paying them $25 an hour to answer the phone. So if you're paying them $10 an hour to answer the phone, you can bonus them $1, or $2 even to close an account, and they would be super ecstatic about it, and they'd
Mm-hmm.
be
Mm-hmm.
super motivated
Yeah, there's a lot of
for
room
you.
to bonus when you're,
Exactly.
starting off at $10. Yeah, for sure.
Hmm.
For sure. I'm wondering, because I really, when the practitioners that are listening, because we have a range of practitioners from, the health coaches all the way up to, the multi 7, 8 figure online or brick and mortar business owners. Um, I want them to really understand like how a VA could like fit into their business. So like if we're trying to save some money or potentially remove some positions, like you guys have been able to condense, like how much money could a regular busy practice save? Like, the service delivery is still there. Clinicians are still there. But like they could save hundreds of thousands, it seems, in salaries.
Yeah, and your salary, you could potentially cut like up to 60% of your salary potentially.
So is it like a ghost town in your office? Just you guys just walking around, just going to patient door, patient door. Say hi to dad
Yeah.
while you walk by. But like, you have obviously been able to kind of reduce down some cost, right?
Hmm.
And you always had a hybrid practice. So if anyone's listening, start thinking, how what could your savings be? And how much more money can you make because maybe you have better quality people, that are actually answering the phones with care or doing your sales and lead management with care. So they actually handle your marketing calls, some of them. Like when people are calling in for programs, for real. So they can really talk to functional programs and, if somebody asks like, I don't know, what would be a question a new caller would ask? What functional labs do you guys run?
I mean, we have all these questions written
Yeah,
out, right? And we have
You
like,
gotta have scripts.
yeah, you
sure.
have scripts,
Yeah.
right? So all these questions, yeah, they have to go through, and if there's a new question, we put it in a document. So ultimately, these things are all searchable. And it's not just only the VA, right? We have to make sure that the VA is also having a higher level of supervision. So is there one supervisor that, hey, the VA really, we also train them. You cannot answer all the questions, right? If there's an angry
Sure.
patient, pass them right away, right? Like, and then we have my in-office staff, or I have another like virtual assistant, but she's American. She just happens to be remotely. Then she,
Hmm.
she handles the call. So there's a stepwise process too, to if handling these marketing calls, and it takes time, right, to train. So yes, not necessarily everybody, but it depends on the VA too. Are they that great at customer service? Then
Sure.
move them on to the next step to answer the marketing calls. Everything takes training. So it's not going to say there's no training, right? Like every employee needs to get trained. They need to get follow up. They need to be audited. They need to continue to perform. And so uh, I think they can
Hmm.
definitely be trained because they're great at it.
Yeah.
Yeah, the easiest first step to that, as if like you're just a solo practice and you're the one doctor or the one health coach running around doing everything, you just need to record all your own calls,
Hmm.
and it's good for you to go back and listen to the calls to see how you can improve. But then you just give those calls, to the virtual assistant. They can listen to the calls. They understand what you should be saying, what you shouldn't be saying,
Sure.
and what you can say, what you can't say, and they understand how to close the the customer then, right, at that point. So it's not like you have to sit down and like do everything yourself. You're already doing it. Just make sure you record it, you know?
No, that's super smart. And like ultimately that's the point of the show, right? Like what can we learn? What tools can we take so we can get like 1% better every day at how we run our business? And I know full well that probably 60 to 70% of the people listening to this podcast, their house is not in order. It's probably very pretty on the outside, right? But as soon as I take that money, it's probably a cascade of things that are happening in the background that could be improved with the proper help if you open your mind to it. And I'm a late adopter. So our agency is now literally this year, really leaning into investing our time and energy in the right VA team to train them up to what our needs are. So practitioners, everybody listening, you may be awesome at patient care, but you have to be good at business. You have to be excellent. You have to be better at business than you are at patient care and delivery, than you are at being a mother, Dr. Carrie, okay? You have to be better at business. Trust me, everything falls in place when the business is solid and protected and taken care of. So, Justin, any last tips or advice, and Dr. Carrie too, for someone who's like, you know what, I'm listening to y'all fine. I'm gonna hire a VA for my practice.
Yeah, I mean, really just give us a call. We'll have a
Start there.
call. We'll discover what's going on. We'll have a discovery call, find out what's going on, find out what your pain points are, what you need help with, and then we'll tell you the tools and tips to kind of help you out along with that, and then utilize the virtual assistants, and the 2-week free trial, to really help your business grow and take to the next level, So if you're interested in that, you can just go to coolblueva.com/bad entrepreneur.
Hey,
and then you'll get the 2-week free trial.
get that trial.
Yeah.
I'm gonna get it because Dr. Carrie, I already told you I got a list of things. I'm just gonna wear them out for 14 days. But Dr. Carrie, what advice do you have for a doctor that's curious about using a VA for medical stuff?
Well, I think it is an investment on your time, right? To be able to invest in somebody else to offload you. I had to learn it in the beginning, and I think it really has made such a big difference that, like I said, I went from 1 to 40. And
Just like that.
my longest employee is actually a VA. Like, I haven't had any physical employees that have beaten her, right? So a few of them, actually, they've just been with us for a long time. They're like family now. And so I know we have built that trust and we continue to grow together, even though we've never physically met each other. Like, we see each other on Zoom every day, right? So just like any of those employees, that I think you should trust in Kuplu VA and what they provide and really give it a try, because who knows how much you're able to offload and have a happier, healthier life too, right? We're all into wellness, and I want the best for all the providers out there. I went through it. I know it's crazy and hard to deal with. So whatever you can offload, really, like, they're amazing. I highly recommend it.
Absolutely. Absolutely. So I think that's a great way to kind of take us on out there. If you can do one thing for yourself and your business to give you more time, right? We all want more impact. We want more income, and we want more time. And so we hope that you've learned ways so you can replace yourself in your business and get your time back. All right. So thank you to the Lams, Justin Lam and Dr. Carrie Lam. Guys, make sure you head on over to microsite.com to catch the show notes and the freebie that Justin is giving us, those 2 free weeks with a VA. Okay, I'm sure there's probably a contract on the back of that, but we're gonna get that 2 free weeks. And I want you guys to make sure you like, share, and subscribe to this podcast everywhere the podcasts are available, and check us out on YouTube as well. We'll see you next week, y'all. Take care. Peace.
Bye.
Hey, y'all, thanks for tuning in to Power Moves Health Marketing Podcast. If you're ready to transform your practice with smarter strategies and cutting-edge tools, I want you to head over to microsite.com to book a strategy session with me and my team. While you're there, check out the show notes for links, resources, and my free Power Moves playbook. Remember, every move you make is a step toward becoming the health business leader you're meant to be. Let's keep building your momentum.